Hi, welcome to Maggie's Highlands. Unfortunately, due to the current social distancing rules and restrictions, we're unable to offer support in Maggie Centre in the ways that we normally would. But please don't worry, we're still here to support you and your family. All you need to do is contact us, either by phone or by email, and we can then arrange an appointment with whichever member of the team is suitable. This could be an appointment by video link, by email, by phone, or perhaps even a pre-booked face-to-face appointment in the centre. At the moment, the centre is only open for pre-booked appointments, but we hope that this will change very soon.
Maggie's is such a great location here at the entrance to Regmore that you can't miss this wonderful building that we're in. You know, it's such a lovely place.
What helped me was Maggie's Centre. The people within Maggie's were able to help me come to terms with things and point me in the right direction of help.
When you're diagnosed with cancer, it can have a big impact. And it can impact you emotionally, psychologically, or physically. These are all things that we can help you with at Maggie's. We have a whole programme of support that's designed to help you begin to feel a little bit more in control in the midst of what can be a huge amount of uncertainty and worry. Coming into Maggie's, you don't need to know what you're going to say, you don't even need to know what you're going to ask. If you just come in, we'll sit down and we'll have a chat with you. During that chat, we'll be helping you figure out what it is that's affecting you the most in terms of your cancer, and we'll be looking at what bits and pieces on our programme we might suggest to help you, mostly to regain feelings of control, to help you understand a bit more about your cancer, maybe understand a bit more about your treatment. And sometimes it's about helping you know who to ask if it isn't us. We can point you towards the people who can answer those questions. After your diagnosis, you might be worried about money, you might be worried about finances. Other people worry about family or friends, the way that the cancer will impact them. And for other people, it's worries about what lies ahead. And these are all things that coming in and speaking to one of our cancer support specialists can really help you with. At any point, you can come in and see us even before your staging results are in. You can come and see us before your surgery, and you can continue coming to see us for a long time after treatment finishes. And actually, when you come into Maggie Centre, you'll not only meet with staff who do understand how you feel, but you'll also be meeting other people who are going through something similar.
I mean, I can be as socially anxious and nervous as the next person, but I could cover it up because I'm a big loudmouth Irishman, you know. But I get anxious in social situations too. So coming in here and meeting everybody who are invariably just nice and have to be prepared for anybody coming from the door.
After going to see the surgeon and getting told, you know, if it's not, I came here to Maggie's after that appointment and spoke to Pam, lovely Pam, who made me feel very accepted and very supported, actually.
So there's no one way to use Maggie's. Whenever you come in, it's how you need to use it. You'll be welcomed by a member of staff or a volunteer, and then you can use the space as you wish. You don't have to be coming to do a group. You can just come to sit and wait between appointments. But then there's always a professional around if you need to speak to someone, either about your cancer, how you're feeling, or even how the rest of your family are feeling.
You don't have to come to any activities, you can just turn up.
Coming to Maggie's, there's always someone you can talk to, or if you don't feel like talking, just come and sit in one of their very cosy chairs and chill out.
I think everyone knows that Maggie exists, and you might think, oh, they're just there, a friendly ear to listen to you. It's when you come in here and you find out all the people you speak to are experienced cancer nurses that with great knowledge of different cancers and the treatments for them and the side effects of these treatments. They're so helpful. They can say, well, go back and say about this treatment, is it what you want, and the side effects, and so I find them first class, and people should be made aware more of Maggie's as a first call for help.
But also here for your family and friends, so they don't have to come in with you, they can come in by themselves and they don't need permission to come in. Also, the person with cancer may be in another part of the country, but the family and friends can still come through our door and make access of our services. Because of the interesting geography of the Highlands, it can be a long way away to get to Maggie's. So we also do a lot of support by the phone. So if you need to speak to us, just give us a call.
My partner has moved up here with us. She's been coming to Maggie Centre as well. So it's not only good for people with cancer, it's also there for people that hasn't got cancer, the family, the friends that are finding it hard to deal with. Maggie's take time out to speak to our loved ones as well.
I tell them all to come into Maggie's, even if it's people that are, they don't have cancer. It's, you know, friends or relatives. I'm like, get yourself into Maggie's because there's so much support there. So they had the Maggie's Kids Day, which they run every couple of months. So they went to that in the January, and my chemo wasn't starting until the April. So they were delighted because they got to see everything before me. You know, they came in, they had a wee art thing I think was going on, and then they went over to the Macmillan Suite, the chemo suite in Regmore Hospital. They got to sit in the big chairs, they got to see cannulas and kind of what went on. They went to the radiotherapy suite. They saw the machines, and because everything moves and it's electronic, they were moving it all, absolutely loving it.
We're very much here to help families because we know cancer doesn't just happen in the body of the person who has the cancer. The effects of cancer actually can affect anybody in the family and all of the friends. So we do a lot of work with families, with parents. We run a monthly group for parents to help them build skills and confidence in helping their children navigate and get through the changes and challenges and difficulties that can come, not just with the diagnosis but with the treatment as well.
Various groups we have, we've got cancer specific network groups, we've also got courses and workshops on that you can tap into, and the great thing with these are that you can explore the impact that cancer's had on you, the emotions, the challenges, but you get to meet others that have experienced similar, and you can learn a lot from that, how to cope better and help to move forward.
I feel more at ease with where I am now. I think it's due to coming to Maggie's, and I come to the man's group every Friday afternoon, just discussing different cancers and where they are, and you see people in a lot worse state than yourself, and you like to encourage them and they encourage you. And
the courses they run here in Maggie's, I've done a few and they've been great as well.
I did therapy sessions here in Maggie's, here in Regmore, and found it great. It was really good.
So when you come in for the first time, you may meet with one of our cancer support specialists, and they may refer you on to myself. I will see you either for one-to-one sessions, or I can see you as a couple with your partner or with your family and friends, however you choose. And also when you're in the centre, you may notice me sort of wandering around. Please feel free to have a chat, as I'll probably be in between some of the groups that I facilitate, or about to go into an appointment. So I'm always happy to stop and have a chat.
I signed up for some therapy sessions as well, which were free, and which we all know it's difficult to get mental health support anywhere, let alone the Highlands, and a lot of long waiting lists. So I took advantage of everything.
And I think I'd been something like diagnosed on the Thursday or Friday, and I went to Maggie's like the following Thursday, and I just walked in and I was like, don't have a clue what I'm doing. It was more a financial thing. I was like, what am I entitled to? Don't really know how this sick pay thing works.
When you're first diagnosed with cancer, I'm not sure the first thing you think about is finances or benefits, but at some point you will, and then is when you should come and see me at the Maggie Centre.
Met a lot of people in Maggie's who had gone through it or were going through it at the same time as me, and we just laughed so much, you know, and even not just breast cancer, different cancers. You know, I've made some really, really good friends that will always be friends.
I mean, the staff here have uniformly always been wonderful.
I mean, last year I wouldn't have been able to do this because I never spoke to anyone about anything. But now, with coming to Maggie's, the help of the people in Maggie's and the help of the fellow patients, I find I can do this now.